I think we'll go ahead and get things underway. And if other people join us, we'll bring them up to speed. So, to start off, my name is Chris Ford. I am the Director of Marketing for Illinois Eastern Community Colleges and Lincoln Trail College, and would love to welcome you to our virtual visit today for health careers and nursing. We've got a lot of great information that we're going to pass on today. And this is certainly just a start for us. We want you to see what we have available here at Lincoln Trail College. And more importantly, we would love to get you here on campus at Lincoln Trail College as well. And with that, I'm going to turn things over to Brent Todd for a welcome and a little bit of an introduction to LTC.
So good afternoon, everyone. I'm glad you could join us today for our virtual health careers visit. As Chris said, my name is Brent Todd. I'm Dean of Instruction here at Lincoln Trail, which means I work closely with our faculty and other staff regarding academic programs. And although we do have many good careers for students to choose in the world in general, there are some great careers for students to pursue. I commend you for exploring the health sciences for a couple of different reasons. First of all those health-related careers are noble professions and need students like you that are oriented toward helping and caring for people. But also because there's been this unprecedented growth in healthcare that's just been continuing for many decades now. And we don't see that in a lot of job markets. But all of the careers in healthcare just keep growing, and projections indicate that due to our aging populations, the recognition for more mental health care and just a general emphasis in well-being, that we're going to continue seeing that projected high growth in healthcares. With that, I just want to say that I'm confident you're all going to find LTC to be a good fit for you, and I hope to see you guys on campus in the fall, if not sooner. I'm going to be here for most of the presentations today, and at any point, if there are questions I can answer for you about faculty and staff or just how things are at Lincoln Trail, I'm happy to do so.
All right, Brent, thank you so much. And we do have a number of faculty and staff joining us today, and we'll kind of get to know people here throughout the course of the day. But I want to start things right off with a giveaway. So we want to give a little something away here, and sorry, faculty and staff, you're not eligible for this. But we're going to start off with a very easy trivia question. So if you want to open up your chat window, and here's the really easy trivia question for us today. And I'm going to ask, where is Lincoln Trail College located? Put your answer in the chat, and we will pick a winner. So we've got two people that have hopped in. Brent has gotten very specific with his answer. Anyone else? I don't even know. So we have a handful of answers. Anyone else want to get their answer in? Oh, we've gotten even more specific with our answer. And again, if everybody could go ahead and sign in with their names and all of that, so we know who you are, and can easily pick our winner here. Mara is getting even more specific with her answers. So we've got a handful of answers, and who is, so I've got one here that is 075553. Who are you?
Is that our winner?
That is our winner.
Oh, good. Oh, that's Veronica. Good.
All right, Veronica, congratulations.
Okay.
We are going to get you some LTC swag. And Tana, would you like to chat with Veronica there and get some pertinent details so we can get her her LTC swag?
Yes.
So, Veronica, congratulations. And let's go ahead and get things underway here. And we are going to start off. So we're covering our health careers programs and our nursing programs. So what we're going to do today is kind of talk a little bit about what is what and kind of what you can expect from our programs. So what I want to do is just kind of start off right away with what exactly is health careers. So we've got a little video for you.
Providing healthcare in America means we need more than just doctors and nurses. That's why Lincoln Trail College offers other health careers-related degrees and certificates. As a certified medical assistant, you do a little bit of everything from making appointments, maintaining records, and handling admissions, to preparing patients for examinations, taking vital signs, and collecting specimens. In electronic medical records, you're reviewing records for health organizations and helping prepare medical reports. The Pharmacy Technician program prepares you to help in a pharmacy. You play a central role in the preparation and delivery of prescriptions. Here's the best part with our programs. We offer degree and certificate options that can help you quickly get started in your career. What are you waiting for? Visit iecc.edu/LTC and let the trail be your path to success.
So that is just a little bit about our health careers programs to give you a quick little introduction into who and what we are. And we have some students from our health careers program with us today. And Mara, I know I see you up in the corner and you have some classmates with you. So if you want to introduce who all you have there with you.
All right. This is Kenna Justice. Hi. My name is Mara Matthews, and this is Lisa Langley, and we are all first-year medical assistant students.
Okay, so I'm going to start off, Mara, I'll start with you because you're right in the middle. Okay. So tell me what your favorite part about Lincoln Trail College and the health careers program has been so far.
My favorite part between Lincoln Trail and my program is definitely the smaller classes and being able to communicate with your instructors. And if you ever have a problem or need something, you can go to their office hours or you can stay after class, and it's not, you don't have to go through 40 other students or an advisor to talk to your instructor, and that's really good.
Okay. Now I want to move to your left and kind of play off that one-on-one attention is very important. So tell me a little bit about how that has helped you.
So in class, it's been nice with Dr. Gullett. He's always very helpful with us. I know that whenever one of us has a questions, if we're in the middle of drawing blood, he's always there. It seems like he's always really helpful for us, and it's really been nice.
So we'll keep going around, and you talked about drawing blood. So I saw, we worked with a couple of you to do some demonstrations, and we're going to show those here in a little bit, but this is a program that's very hands-on. And talk about the importance of that.
I love that it gives you the realization of what it's going to be like when you actually get into a job role as a CCMA. And having Mr. Jared there to walk you through it is very, very helpful because he's right there. If you're missing a step or if you seem hesitant, he's right there encouraging you 110%. So he knows that when you're out there and you're actually in your job role that you're going to do and give 110% every time.
Okay. And Mara, we'll go back to you. How well do you feel your time here at LTC has prepared you for your next steps?
I think it's prepared me a lot because especially going to a medical assistant the medical assistant program and stuff when I graduate, medical assisting is in high demand. So I feel like once I graduate, I have an easy route to my future job.
Okay. And keep kind of going around the room. When you graduate from LTC, what are your future plans and goals?
So whenever I graduate next May, I plan on moving back to Evansville, Indiana, and getting in at Deaconess to be a CMA. They have a lot of positions open, and it's in a high demand. And from there, I'm just going to kind of see where it goes.
Okay. And then our last question that we have is, what advice would you give for someone that's about to start at LTC in the CMA program or in health careers?
I advise them to jump in and do it. It's a great program. It's very hands-on. The instructors are great, and don't let anything hold you back. It's been a great experience.
Awesome. So one of the other things that we had the opportunity to do is talk with an alumni from our program, and that is Kathleen Harris, and she just graduated here in 2020. So this is something that we recorded a little bit ago, and here's what she had to say. All right, joining us now is Kathleen Harris, and you are a 2020 graduate of our Health Careers program. How are you today?
Yes, I am fabulous, and you?
I am good, thank you. So let's just kind of start off. What was your favorite part about the health careers and the certified medical assistant program here at LTC?
Just all of it. I liked working with the different instructors. I liked learning the different styles that they used. All the ladies and gentlemen in the health careers department. I especially liked doing the clinicals. I liked testing my skills, and the internship was a lot of fun, and I learned a lot there too.
How important do you feel that internship was?
Oh, it's absolutely important. It is one of the most important parts, I feel. You can do it all day long on a dummy, and it does not do the same thing as doing it on a person, as far as like taking blood, giving shots, things like that, because there's always got to be that personal touch, and everybody's different. Everybody reacts different.
All right. So I know one of the really nice things here at Lincoln Trail is there is a lot of one-on-one attention that you get in your classes. Talk about
Absolutely.
The importance of that.
It was really helpful, especially doing the ICD-10 coding, because that is constantly changing. That is one of the things that we have to learn as far as a CMA in the program, so that you can do billing and insurance billing and things like that. Laurie Jenkins and Jared Gullett were extremely hands-on with that, and it made it much easier.
So for you were somebody that came back to school, after you had kind of been off and done your own thing for a little bit. Talk about the transition of what it was like for you to come back to college.
Well, I went in with a notepad and an ink pen and felt completely out of place because everybody else was carrying around computers. But it was different, but it wasn't, because I wasn't treated any differently. I wasn't treated like I should know more because I'm older, and I wasn't treated really any differently. It was an extremely rewarding thing to do at 40 years old.
So how well do you feel that the program has prepared you?
I feel that I'm prepared. There were some clinical things that I felt a little unprepared for, but it wasn't lack of teaching. It was just my lack of confidence. But as far as like the administrative assistant part, which is what I certified for as a certified medical assistant, administrative assistant, the paperwork end, I was more than prepared for.
So we're talking today with people that are considering Lincoln Trail College, considering our health careers programs and our nursing programs. What advice do you have for them?
Do it. What do you have to lose? LTC is a great starting place, and then you can move on if you want to, but LTC is a great family college. You feel like you're part of the family with not just the students but the staff. It is an excellent place to begin your journey. Awesome.
Kathleen, is there anything else you want to talk about today?
I think just, especially with this time, with everything we're going through right now, they might be a little afraid to join the medical community. But the medical community is taking care of each other. So don't be afraid to join into it at this point. Don't be afraid. We are just as important as the nurses and doctors. We kind of set the stage for the rest of the way their visit will be as a CMA. We're one of the first and last faces they see. So don't be afraid to jump in with both feet. LTC's got you covered.
All right, Kathleen Harris, awesome. Thank you so much for joining us today.
All right.
All right, so there's a little bit from one of our alumni, Kathleen Harris, talking about what she did in the health careers programs. And one of the things that we like to do during our visits is share and let people see what some of the hands-on things that we do. And we want to continue doing that here with our virtual visits. So we have pre-recorded some demonstrations from a couple of our students that you have met already.
I'm Mara Matthews. I'm from Annapolis, Illinois, and I am enrolled in the Certified Medical Assistant program. Today I'm going to demonstrate how to do blood pressure, and what you're going to use is you're going to use a stethoscope and a blood pressure cuff. You're basically testing the arterial blood pressure, and you're going to listen for the systolic and diastolic. Those are the two most important things when doing blood pressure. The systolic is the first heartbeat that you're going to hear, and it's very steady. And that is when the arteries and the heart contract. And then diastolic is when it completely stops. You're not going to hear anything. And that's when it's relaxing. So basically what you're going to do is I'm going to get my stethoscope ready. And she's going to give me her arm. She's going to relax it. And you want to make sure when you're placing it up, you have this all facing the front. And it tells you whether it's the right or the left. So we're going to wrap it around. Make sure it's tight and it's at least a good ways above. Make sure it's tight. And so you're going to make sure this is all. It's tight so we can inflate it with air. And you want to make sure your stethoscope earpieces are facing the inner parts of your ear. And you're going to place this right in the middle of the bend of the elbow. So we're going to inflate it. We're going to listen for the systolic. Okay, so I got her at 112/80. Yes, that's basically how you demonstrate blood pressure.
My name's Lisa Langley, and I am from Robinson, Illinois, and I am enrolled in the Certified Medical Assistant program at LTC. Today, I am going to be demonstrating on my patient Mara how to do a glucose check, which is measuring the sugar in your bloodstream. But first, you want to wash your hand, which I already did. I'm going to apply Germ-X just to walk you through the motion. You want to lather up, make sure they're good and dry. If you go to the bathroom, obviously you have your own procedure for washing hands. But you're going to apply sterile gloves, which just came out of the box. First, you're going to ask the patient her name and date of birth, and you're going to make sure that it's correct on the doctor's orders. So typically you'd say, can you verify your name, date of birth for me? And then the patient would. You're going to pick either the middle finger or the ring finger on either hand. It's kind of, you can ask their preference if you want to. I'm going to go with the middle finger on her right hand. And you're going to open an alcohol swab. You're going to swab the tip of the finger to make it sterile. Then I'm going to pull out my test strip. I'm going to go ahead and I have my glucometer here. I'm going to place the test strip in the top of the machine, and it's going to turn on, and it's going to tell you to apply blood. You're going to take the tip of your lancet off. You want to apply firm pressure to the tip of the finger, and I always go to the medial side. You're going to put pressure on the lancet and then release. The first pool of blood you're going to get, you're going to wipe away with a gauze. which I'm opening now. You wipe it away. You're going to apply pressure, but you do not want to milk. You're going to take the test strip that's attached to your glucometer. You do not want to touch the tip of the strip to the actual finger. You want to just gently touch the pool of blood. It's going to go across. You're going to give your patient her gauze and ask the patient to apply pressure. It's going to give you a blood glucose reading, which is 93, and your normal range is typically anywhere from 90 to 120. That's going to kind of depend on what the patient's eaten that day. If they're fasting, it could be lower. If they've just eaten a donut for breakfast, maybe a little higher. But then you want to make sure your sharps goes into the sharp container. Anything that touched the patient that could have any body fluid or anything of the sorts goes in a biohazard trash, and then that's a glucose check.
So that is a quick couple of demonstrations here from our health career students. They did a great job with that. And right now I want to bring in Dr. Jared Gullett and Jamie Carmen to talk a little bit about how you can get started in health careers and the kinds of jobs you can get through our health careers programs. So I will turn it over to you guys.
Hi, I'm Jamie Carmen. I'm the academic advisor for health career programs such as electronic medical records, medicist, and pharmacy technician. Electronic medical records is a one-year certificate, and the CMA program can be done as a one-year certificate or a two-year degree, and I'll turn it over to Dr. Gullett to talk to you more about that.
Hey guys, I'm Dr. Jared Gullett. I'm the lead instructor over the Health Careers program. As far as jobs go, I get calls weekly for CMAs, for people that have any electronic medical records experience, especially hospitals. Locally, there are several doctors' offices, things like that, that are really, needing help in their offices. And, it's like we can't graduate enough people quick enough. So there are definitely jobs out there, and if there's anybody of interest in the program, we would love to have you. We can give you a tour. We can talk to you more, but, just let us know and we'll be there for you. So.
All right. Thank you very much. So that is a start at a look at our health careers programs. And certainly, if you want to know more about them, definitely give us a call, 618-544-8657. And that is a great way to get started. Of course, you can also visit our website, which is iecc.edu/LTC. So now we're going to jump into our nursing program. And again, just want to give you a quick rundown about what is nursing.
It takes a special person to be a nurse. You are there to help someone improve their health, their healing, and their hope. Your job is about caring. You're there when people want to maintain their wellness, and you're there when people are going through their darkest days. At Lincoln Trail College, we prepare you for all aspects of your career as a nurse. Our program combines classroom experiences with hands-on instruction to prepare you for the real world. Our instructors are experts because they've lived it. America needs healthcare heroes, and America needs them now. There are job opportunities close to home and all around the country. What are you waiting for? It all starts right here at Lincoln Trail College. Check us out at iecc.edu/LTC and let the trail be your path to success.
So there is a quick introduction of what nursing is. And right now I want to bring in some of our current nursing students, and you're going to get to see a little bit more of them here in a little bit too, as they take you through a few demonstrations. So I will let you guys all introduce yourselves.
I am Megan Wager. I'm in the nursing program as a first-year student.
I'm Catherine Luking. I'm also a first-year student in the nursing program.
And I'm Hillary Huddleston, another first-year nursing student.
All right, Megan, I'm going to start with you because you were the one that went first. So tell me what your favorite part is about Lincoln Trail College and the nursing program.
I love the small class sizes and allows for a lot of one-on-one attention from the instructors. The instructors are always really open to helping anyone who may need help and make sure to go out of their way to make sure all the questions are answered. And I also love the hands-on clinical experience that we get from beginning.
Okay. Catherine, she talked about the one-on-one attention. How important has that been for you, and how has that helped you?
That's very important. The one-on-one attention actually is one of the reasons I chose Lincoln Trail, because I was able to easily get in contact with someone in the admissions office and the advisor, and then she helped me walk me through the process. And then once I was in the classroom, I find that the instructors are always ready to help. When you have a question, they have very quick turnaround in their answers and are just always available to help you out.
Okay. Hillary, talk about the importance of the hands-on education.
I think it's crucial. Absolutely. In a hands-on field like nursing, you have to be able to have practice and have those skills, already know what you're doing before you get into the room. And so we practice in the classroom. We go to clinicals very quickly from the very beginning, as one of the girls mentioned already. So you immediately start working with patients from the very get-go. We have post-conferences where we get to kind of compare and see what other patients people have had that day. So we get to discuss multiple scenarios and, how would you have done this differently? How should we have done this time? So we're always learning and always getting more information.
Okay. Megan, how well do you feel your time here at LTC has prepared you for your next steps as a nurse?
I think the clinical experience from the beginning has played a huge role in me feeling prepared. Like Hillary said, like the hands-on and the patient interaction is very crucial. And I feel like that's going to play the biggest role in me feeling comfortable whenever it's time to get a job.
Catherine, talk a little bit about your future plans and goals when you graduate from LTC.
Sure. Following graduation, I would really like to work in the clinic setting and work with perhaps some underserved populations.
Awesome. And Hillary, what is some advice that you would give someone that's about to start here at LTC in the nursing program?
Just get in touch with Kyra. She's always very helpful and very open. She's always, like Catherine mentioned earlier, very quick turnaround. So if you have any questions at all, if she doesn't know the answer, she will find the answer for you. And then just jump in and do it. Come prepared. They were very upfront with us from the beginning that it is a lot of work, but it's absolutely worth it. And they were 100% right about that.
Okay. Ladies, awesome. Thank you so much. And just like when we did the Health Careers program, we had the opportunity to speak with one of our nursing alumni. And in this case, we had a chance to speak with Joe Franklin. And here's what he had to say to us. All right, I'm joined now by Joe Franklin, who is a 2018 graduate of Lincoln Trail College, and you are currently an RN at Good Samaritan Hospital. How are you today?
I'm good, Chris. Nice to talk with you today.
Absolutely. So just to start off with, Joe, tell me a little bit about what you are up to today.
Mm-hmm. So as you know, I graduated in 2018 from Lincoln Trail College nursing program. For me, that was a little bit of a career change. And so since 2018, I started out as a brand new nurse on inpatient psych. And over the last couple of years, I've worked my way into our shift coordinator role, which is a little bit of nursing. It's a little bit of administration and quite a bit of education for our floor. So I do things like scheduling and a lot of chart reviews and just a lot of administrative things. And then also, I take care of the educational needs for our floor, so for our patients and for our staff.
Okay. Talk about how Lincoln Trail College prepared you for this.
So LTC, one thing that I love about the program is that the educators there do everything they can to prepare us as nurses, not just for the basic tasks that we're going to do at the bedside, but for everything in terms of critical thinking. So we come out of the box or right out of the gate with having the tools that we need to really, really succeed. Nursing is a career that gives a lot of options, and with those options comes a lot of responsibility. And so I believe that LTC really prepares new nurses to hit the ground running.
So along those lines, what was your favorite part about the nursing program here?
One of my favorite things about the nursing program really is the level of instruction and also the cohesion that is created. The relationships that I formed between myself and other nursing students still exist today. And so for me, that the cohesion and the level of professionalism are two things that will always stick with me. I get to be able to interact with some of my nursing instructors from 2.5 years ago, and I get to see how my relationship with them has changed. So getting to work with some of my instructors in my current workplace and watching another instructor bring nursing students into our facility from LTC is really a cool thing.
So we're talking to people today that are thinking about getting into nursing and health careers. What advice would you have for them?
I would say make a decision and go with it. Definitely, I think for myself, like I said, it was a career change for me, and going into nursing was a little bit of a gamble. I didn't know if I was going to be able to complete the program. I didn't know what I was going to do after I finished. But I learned that it's just that day-to-day application and doing the basic tasks required for school every day. It turned out to be such a good investment. And I've only been a nurse for coming up on 3 years, but for me personally, the return on investment, I'm already seeing it. So I remember one of the instructors saying, the money that you spend at LTC, you're going to see back really, really quickly. And I've seen it already. So I say, get in the program, get involved, get in front with anything that you could possibly do in the program, whether that's in the classroom or clinicals, and don't give up.
Awesome. Joe, is there anything else you want to say today?
Nope. Thanks a bunch, Chris.
All right. Thanks for joining us. All right. So that is Joe Franklin, a graduate here from our program. And with that, we also had the opportunity to do some demonstrations from our nursing students and the three that you met earlier. So I want to give you a chance to see the work that they did.
Hi, I'm Megan Wager, and I'm from Robinson, Illinois, and I'm in the nursing program at Lincoln Trail College, and I will be demonstrating NG tube irrigation. So to start off, we want to check the placement of the NG tube. To do this, we inject 20 milliliters of air into the NG tube and listen to the stomach while we do this. And then we pull up some stomach contents. Then we check the pH of the stomach contents. It has to be between 1 and 5. And then for the irrigation, we take 20 mLs of solution and kink the tube and put the 20 mils in and draw it back out. And if you have no issues doing this, then you're done with the procedure, but if not, then you'll repeat the procedure.
Hi, I'm Hillary Huddleston. I'm a student at Lincoln Trail College in the nursing program, and today I'm going to be demonstrating how to give a bolus feeding through an NG tube. So the first thing we would do would be to check placement of the tube. Megan showed that in her previous video on irrigating an NG tube, so I will be skipping that step today, but you would do that first. Then I would want to check the residual contents of the stomach. If the contents were more than 100 milliliters, then you would have to pause the feeding and try an hour later. But if it's less than that, then you can go ahead with the feeding. So in this case, we're going to say the contents are 30 milliliters, so we can continue with the feeding. We're going to put those back into the stomach before we start. We're going to remove the tube, keep it kinked. Remove the plunger from the tube and hook it back up. This formula has already been checked for compatibility with the patient's meds. We'll start with putting in some 30 milliliters of water to flush the tube. And then we would slowly work by putting the formula through the tube as well. And this whole process would take about 5 or 10 minutes. We'll say that's all the way through. Afterwards, we would flush the tube with another 30 milliliters of water. And then we're going to plug the tube and provide oral care to the client, make sure they're in a comfortable position. They would need to remain upright for at least 30 to 60 minutes after their feeding to prevent any aspiration, and then document all the important parts of the procedure.
Hi, I'm Catherine Luking. I'm from Sullivan, Indiana, and I am a nursing student at Lincoln Trail College, and I'm going to demonstrate how to remove an NG tube. The first thing I would do is I would drape my patient. Next, I would get the bag ready and place it at the end of the bed. Now I'm going to instill 15 mLs of air into the tube. Next, I'm going to instruct my patient to take a deep breath, and then I'm going to remove the tube. Following the removal of the tube, I would provide oral and nasal care for my patient, and then that would be complete.
All right, so that's a look at some of the work that you can do in the nursing program. A great job. And with that, now I want to bring in our nursing advisor, Kyra Buchanan. I see we've got several members of our nursing faculty as well. So if you would like to introduce yourselves as well.
Well, I'm Kyra Buchanan, and I am the advisor for the nursing program. A lot of the students that are on with us today, the current nursing students, they started by calling the school and asking about nursing. And they made an appointment with me, and I would be happy to make appointments with students. My office is located in Williams Hall at Lincoln Trail College. And we do have 9 support classes that go with our nursing program. So if you're a high school student today, I really push those dual credits for our students that you can do that in high school. We also have a CNA program that is required for nursing. Another great place to get that done is the high school level. We do offer CNA here every semester, but keep that in mind, the high school does offer that as well. And I'm going to go ahead and turn this over to Angie, who can tell you a little bit more about the program. But please, again, if you're interested in nursing, call me.
I am Angie Williams, Department Head of Nursing here at Lincoln Trail College, and we want to be a part of your journey. 3 out of our nursing faculty acquired their nursing degree through Lincoln Trail College. We're proud of our alumni, we're proud of our nursing students. We are vested in our community, the nursing program, and our students. We start our program from simple to complex. We believe in a very firm foundation of your fundamentals, and then we build upon those. We start from the day one talking NCLEX and wanting to get you prepared to pass your NCLEX, your boards, and we want to develop competent and confident nurses. I don't even know what else to say other than from my own experience from Lincoln Trail College and then transitioning years later into the educational role here. Lincoln Trail has been an awesome experience from day one, starting as a nursing student, and then being able to have the responsibility and the honor to be able to teach our nursing students.
Lori, Brittany, I see you're on here as well. Do you guys want to add anything?
Hi, I'm Lori Jenkins, another one of the nursing instructors and alumni here. And I think Mrs. Williams said it perfectly. I think we love seeing our alumni students. It was great seeing Joe on his interview, and it was just nice. So I look forward to seeing new students in the future.
And I agree. I'm Brittany Kaparis, and I'm one of the instructors as well. I agree with what everyone has said.
Okay, so I want to do one more giveaway here, and this will be open to everyone again, except our faculty and staff. And I'm going to make it kind of easy. So I'm going to tell you when to put in your answer, and then we are going to pick a random number from the answers that we get, and that will determine our winners. So you had a chance to see 5 different demonstrations today. So I'm going to count to 3. When I count to 3, I want you to enter in one of those demonstrations that you saw today, one of the 5 that you saw today. So again, one of the 5 demonstrations, I'm going to count to 3 and enter it in the chat. And then we will draw a random number to get our winners. So here we go. If you're ready. 1, 2, 3.
Dean Todd did not listen to instructions because he was not supposed to answer.
Yes. So does anyone else want to put in an answer? If not, Brent, pick a number between 1 and 4.
3.
Okay, so 3. That would be Veronica winning again.
Okay.
All right. So Veronica, double swag for you.
I will have to put something else in her bag.
Yes. Awesome. So you've heard a little bit about the basics for our nursing and our health careers programs. And now I want to turn things over to Amber Malone and Tana Ambrose to talk a little bit about the general admission process here for Lincoln Trail College.
Good afternoon. I am Amber Malone. I'm the Associate Director for Admissions and Records for Illinois Eastern Community Colleges. Welcome. We want to make applying as easy as possible. So you can go to our website. I'll put that in the chat, just iecc.edu/apply. Our application is free. It takes about 10 minutes. And you will need your Social Security number. So keep that in mind as you prepare items to sit down and fill out your application. Once you complete the application, you will receive a text that will tell you about our Entrada portal. And that kind of allows you to set up your own kind of website for LTC that will tell you everything that you need to know. And then you'll also, if you're interested in health careers, if you're interested in nursing, you'll receive a contact from Kyra Buchanan. She will actually contact you by phone or by email. If you're applying to one of the other programs, you'll also receive a packet of information as well. So we will contact you afterwards, and then you're welcome to contact us if you have any immediate questions after you complete your application. If you have applied already, we have an admitted student day coming up on May 1st. So on Saturday, May 1st, you can come to campus from 10:30 to noon. We will offer tours. You can talk with faculty and staff, student groups and organizations will be represented, and you can really get a good feel for what it's like to be a student on campus for that hour and a half. So if you plan to join us on May 1st, you can look for one of these postcards to be mailed to your house, or you can go directly to our website and sign up for that day as well. Tana, do you have some information for our students as well?
Yes, I will put my contact information in the chat so that anyone on the call can reach me via cell phone call or text or email. And I would love to show you around campus. So I am here on Tuesdays and Thursdays, but can be here on other days of the week as well if another day works better for you. And I love my job as the Director of College Access and enjoy talking with students about their future careers and interest and pinpointing exactly what it is they'd like to do. And I think that is, it's fun when it starts with a tour of Lincoln Trail College. And so if you've never been to our campus, I would enjoy hearing from you and showing you around and connecting you with all of the wonderful people who you have seen on this call today and helping you start to move forward with your future.
All right, Amber and Tana, thank you. And I know one of the big questions as people get ready to start college is, how in the world do I pay for college? And with that, I'm going to turn things over to Crystal Riggle, who handles financial aid here for Lincoln Trail College.
Hi, I'm Crystal Riggle, and I'm the financial aid coordinator here at Lincoln Trail College. As Chris said, one of the biggest concerns with going to school is how you're going to pay for it. All the programs here that you've heard about are great, but don't let financial aid deter you from coming to school. Get in contact with our office. The biggest thing that we can stress is to get your FAFSA filled out as soon as possible. Once you get it filled out, make contact with our office and we can go through all the options that are available for financial aid for your specific degree and specific financial situation that you have. You can reach our office either on the phone or you can email us. Just stay in communication. We send lots of emails and lots of text messages, so I encourage every student to check their IDCC email because that is how we communicate.
Okay, so, again, very important. There's so much, available on our website, iecc.edu/LTC. And, certainly, as you heard, once you apply, you can get started with that Entrada account. And as you keep working through that, it's very important to also make sure that you are keeping up to date with your emails and finding everything that you need on there. So with that, again, we would love to see you on campus. Give us a call, 618-544-8657. You can also email Tana, put her email in the chat to get started. And there's also email for a few other people. I see Crystal Riggle's email is in there. Amber Malone's email is in there. So if you have questions for anyone, definitely reach out to us. We're here to help you, and that's what we want to do. So we've taken up a good chunk of an hour today, but want to thank everybody that has helped out. Certainly our students who hopped in and did our student panels today for health careers and nursing, and they did a fabulous job with their demonstrations, as well as everybody else that was here with us today. So thank you guys very much, and look forward to seeing you guys on campus. So with that, so long, everybody.